for attending this live session where we have two wonderful guest speakers that we'll introduce in just a moment. But this is our We Do Care community event where we're teaching you how to advocate for yourself through your perimenopausal transition. And so we just want to start out with a quick poll question. So again, those who are logged in already and ready to start answering, we just want to know what brought you to this conversation today. So I'll go ahead and throw that out there, and you should be able to see it on your screen now, and go ahead and start answering that question. Again, what brought you here today? So do you want to understand your symptoms better? Do you want to learn how to talk to your doctor? Do you want to hear from our two lovely experts today? Do you want to feel kind of less alone, build a community around as you're going through this? So go ahead and pick which answer really speaks to you today for why you're attending this session. And as people are joining, we'll start our introductions in just a moment. It looks like so far, they really want to hear from the two of you, the two experts. So again, it's wonderful that the two of you can be here. I'll let you guys take turns introducing yourselves while, again, everyone's kind of hopping on. So our two guest speakers today are Dr. Morgan Mendigo and Dr. Deanna Minnick. And so I'll let you each take turns introducing yourself.
Okay. Hi, everyone. Let's see if I can get my screen sharing up. Here we go. All right. Are we good, Rose? Did it work?
Yep, here it is.
All right. So I'm Dr. Morgan Mendigo. I'm a board certified OBGYN and a Menopause Society certified practitioner. I practice locally in Southern California, and I'm a big advocate for health equity, health access. And so I have my own practice, Empower Women's Health. And I do telehealth for women who do not live in my zip code. And I also contract with a couple companies that are doing great things for access to perimenopause, menopause care specifically, a whole lot of other things too, but MIDI Health and Maven Clinic. And then I enjoy working with companies like Mira that are filling in some of those gaps that traditional healthcare has left us, particularly in perimenopause and menopause. So I am excited to be here and join this discussion with you all. And I think I'd like to start off with 5 things that I wish women knew to optimize their care, in the doctor's office setting. So without further ado, number 1, how to find an expert. And, we're kind of in exciting times. Things are changing. Very recently, depending on where you live, if you're in a rural area, your primary care doc or your OBGYN even may not be up to date with the most up-to-date evidence on menopause and perimenopause care. And that's changing rapidly, which is exciting. So if you remember one thing from me today, I hope it's to check out menopause.org. So that is the website of Menopause Society, and they maintain a database of practitioners who are experts in menopause care. And they even designate which practitioners have attained the special certification by the National Menopause Society of an MSCP. So they've gone through additional exams to prove that they practice evidence-based menopause care. So you can search the directory to find somebody local to you who's an expert. And if you can't find somebody in your area, that's where telehealth really shines. And so some of these companies are in all 50 states. They take all the major PPO insurances, and you can even get an appointment, sometimes in the evenings after work in a time frame of 1 to 2 weeks from when you first sign up. So now is really a brave new world where you can access an expert no matter where you live in the United States. You just have to know the secret of where to find us. Number 2, your insurance probably does cover HRT. So our terms are kind of changing. HRT is kind of going out the window, and now we're using MHT, menopause hormone therapy. This is essentially the same as bioidenticals. That's not a medical term. It's more of a marketing term, but that tends to be what women are most interested in, and really where the science is leading us in terms of hormone treatments. But it breaks my heart when I see somebody who is paying hundreds of dollars per month for compounded creams and pellets, and they have never been told that there are FDA approved options that they could consider that may be covered by their insurance. So just know that if you have a major PPO, if you don't have prescription coverage, if you have catastrophic care, then that might not be the case for you. But if you have a major PPO, there probably are hormonal options for you that are bioidentical that are covered by your insurance. Number 3, be wary of social media, the good, bad, and ugly. The plus side is we are getting so much exposure to perimenopause and menopause, and there is so much good information out there reaching all of us. But there's also a lot of misinformation on social media. Even the docs. So the menopause influencers, just be advised of, they do have financial incentives. They all have cash-based practices, they have books they're selling, podcasts that they need subscribers for, supplements that they're selling. And so they're financially motivated to make reels that are sensational, that could potentially go viral. They're counting their clicks and their shares. So even when they're talking about a scientific article, the headlines that you see from social media may not reflect some of the intricacies of the conclusions that you can really draw from that literature. So you can imagine a dense 30-page scientific publication is pretty hard to boil down to a 59-second TikTok video. So sometimes they may be touting a mouse study, or a study with only 15 people in it, or some studies that have significant limitations or conflicts of interest. So just always keep your spidey sense on, because there's really great information out there, but also a lot of misinformation. Number 4, this is my favorite, blood work for hormone levels. It's garbage. And that's why I'm here today. I think Mira is doing some cool innovations, because what I have at my disposal, like under the umbrella of insurance paid care, just really doesn't cut it. And we weren't moving the needle fast enough in academics and government funded research, and I think that's a really cool thing that companies are doing, is really pushing innovation along. So women come into my office with a number of perimenopausal related concerns, and the conclusion is my hormones are off. Let's check my hormones. And what I have at my disposal, covered hopefully by insurance, is you go to Quest or LabCorp and you have your blood work drawn once. We could do a panel of 20 hormones, but you've got one snapshot in time. And we are really a whole lot more complicated than that. So ultimately, it doesn't give us any answers. The upshot of that is we can't treat women just like a number, and we have to actually listen and treat symptoms. And so that's what we do, but it doesn't mean that you can't get an answer to why is this happening. Everybody deserves to know, things are changing in my body. I'm experiencing changes that are affecting my life, my work. What is happening? What is different? And I think that is an opportunity that Mira presents us with, is to use urinary testing to see how your hormones are changing. Because I may have an estradiol level of 50, and Rose may have an estradiol level of 50, and we may experience that in very dramatically different ways. I may have different metabolic functionalities and different cortisol levels and other hormones at play. My levels may be going up while Rose's are going down. We may have those hormones targeted to different organs in our body with different receptors and biochemical pathways that are triggered by those interactions. So it's a whole lot more complex than just, what does the blood work say your estrogen level is right now? So that's not very helpful. And oftentimes women get stuck with a lab that is just normal and a big bill for it because the insurance company decides they're not going to cover it. But yeah, a lot can be answered by urine testing, correlating what you're experiencing with how your hormone levels are changing over the course of your cycle.
Wonderful.
And lastly, stick with me here. The answer is not always menopausal hormone therapy or bioidenticals or HRT, whatever you want to call it. I think one thing that really excites me about what I do is that there's an art and a science to it. And every woman is individualized and different and experiences this transition differently. And that evolves even during the course of her life. And so particularly I think that the social media effect that we're seeing is women are getting care earlier. They're paying attention to their bodies and what's changing, and coming to doctors like me earlier. And so in your 30s, in your 40s, maybe the answer is bioidentical hormones, but there are also other options. Sometimes even, the old tools in our toolbox, the birth control pills and the IUDs, maybe in creative ways in combination with estradiol patches, may be the right set of things for you to minimize side effects and mitigate the symptoms that you're having. So there is an evolution, but keep your mind open because we've got a lot of tools. I think Dr. Minnick's going to talk about some of them that aren't just treat with hormones. So it's a lot more exciting than just throw on a patch.
Wonderful. I can't wait
That
to
is
ask
it
you
for
some
me.
questions. Yeah, I can't wait to ask some questions about these things, but I'll wait till we get to our panel discussion here. So for those who just joined, we're doing kind of tag teaming. So Dr. Mandigo just presented, and I'll let Dr. Deanna Minnick present, and then we'll go into our panel discussion. If you have questions, feel free to write them in the chat now. We'll be throwing out additional poll questions as well. So I'll pass it over to Dr. Deanna Minnick.
Thank you. Thank you, Dr. Mandigo. That was really, I think you contextualized those bullet points so succinctly and so practically, really useful. So I would say that I could complement your medical training because I'm the science nerd and I'm the person that does like studies, and I do have familiarity in the natural products industry. And I'm also trained in what's called functional medicine. I'm actually at the Institute for Functional Medicine right now doing some teaching today. So let me just bring up my slides and just go through some of my kind of science-y aspects that may help you with, okay, let me just be sure I can do it. How's that? You're seeing the Symphony screen?
Mm-hmm.
Okay, super. All right. So yes, in full disclosure, just like Dr. Mendigo said, you always have to know what your source is and the source of information. I am a chief science officer at Symphony Natural Health. I actually decided to join Symphony as a contractor, not an employee, but because I was feeling, well, actually, I was going through perimenopause, and I was at a stage of my career where I was feeling like I need to do more with women's health, with my own health. And since I was a teenager, I have had issues with my reproductive system. So I felt that Symphony was more than a product company. The CEO has been in this whole arena of women's health for many decades and has this vision of taking women on a journey physically, emotionally, mentally, and even spiritually. Because if we look at perimenopause and what it's about, it's a true transformation. So I just want to mention that I feel so, I would say, honored and privileged to have this opportunity to work with a larger team. And we do have an OBGYN that we work with, Dr. Wendy Warner. Dr. Tori Hudson, some of you may have heard her name. She is a naturopathic doctor, well known in women's medicine. We have a number of other types of practitioners as well. So one of the things that I think about if I'm on social media and if I was in your shoes and kind of looking at, well, what's out there? How do I become empowered? What are the questions that I ask? And further, how do I understand my body better? I do think that one of the things that we're hearing a lot about as it relates to menopause is that it's all about the ovaries. It's all about the brain signaling to the ovaries. The ovaries are declining, and now we have this issue with hormones. And we do. That's a true statement. However, it's a little bit more complex than that. We have within us this whole endocrine system. All of these different glands are producing all of these different hormones and they're interacting. So, over time, what can happen is that we start to see changes in the function of these different glands. And so, even though menopause is completely natural, and this is what we're meant to go through, some women may actually go through it earlier and have worse symptoms because they have some other changes and decline in their endocrine system. The endocrine system in functional medicine is all about communication. It's about the brain talking to the ovaries, it's about the brain talking to the adrenals, adrenals talk to the ovaries. So, so to speak, and not literally, but through chemical messengers like hormones. And so sometimes this communication in the body is distorted or it's not speaking the right language. It's kind of like an orchestra where you have the conductor, which might be the brain, and then you have all of these different glands, but there might be one of those glands that's just off tune. So then it signals differently throughout the whole system. So when I think of this whole endocrine system, we have to look at our adrenals, which would help us to understand our stress response. And if we think back to our teens, maybe even our childhood, maybe having childhood adverse experiences that primed us towards more stress. So thinking about our stress response is important when we're thinking about menopause. And in fact, we even see that women that have more issues with stress or even with their perception of stress may actually have more menopausal symptoms, especially hot flashes, night sweats, a lot of the what we would call more of the cardiovascular connected symptoms. And then for some women, they start to notice that they start to have thyroid issues, that maybe that starts to crop up in her 30s or her 40s. And maybe every stretch of the way, there were issues with the gut. And the gut is also an endocrine focused organ. It's not just for digestion and absorption, it is also signaling the endocrine system. It is endocrine in nature. So when we're thinking about our entire endocrine system, we want to make sure that the whole of the endocrine system is healthy. And I really like what Dr. Mendigo was saying about, it's just not about more hormones. We have to look at the whole complex of what's happening when we put hormones in the body. Many women are concerned about just their aging process and how their brain is going to shake out in the years to come. And what about their bones? What about their mood? And one of the important features is truly to look at the gut and how we are metabolizing. And there's so much that is connected between the gut and the reproductive organs like the uterus and the ovaries. I also want to toss into this mix. I do a lot of teaching on what we call environmental health or the toxins in our environment. And for women who are exposed to many toxins throughout their lives, and that could be everything in food or water, air, personal care products, all of these things, they start to accumulate in the body and eventually they can lead to changes in the ovarian function and even increase ovarian aging. So hormones are not just things that we want more of in the body. We also have to know how to metabolize them correctly and excrete them. So it's kind of like the input and the output. And similarly with a lot of these different, what we call endocrine disruptors, which can change our hormone function. So I'll just quickly show this. In functional medicine, we talk about why does the endocrine system decline? We know that genetics can play a role. If a woman has certain diseases, especially autoimmune disease or some inflammation, there can be some issues there. If she has nutrient insufficiencies and deficiencies, we want to be thinking about that, because hormone production in the body it requires nutrients. We need things like cholesterol. We need things like protein. We also need proper hydration to move those hormones around the body. So please be thinking about nutrition as you go to see your providers, and that you're thinking about optimizing hormone, I would say, synthesis, as well as metabolism and excretion. And then keep in mind that certain things can, come up in our lives, just like a bump in the road, certain things that are triggers, whether they're stressors, or maybe we are not sleeping well, we are drinking alcohol occasionally. These things can maybe cause even more issues as we move into the perimenopause. And then lots of different things can keep that endocrine decline in motion. So if we're continuing with a lot of the personal care products, a lot of the endocrine disruptors, the stress, the nutrient poor diet, we're not very active, all of these things, they do play a role. So nutrition and lifestyle is a key message that I feel has been left out of menopause care, whether we're talking about perimenopause or postmenopause. And we're seeing more and more research, fortunately. And then I'll just show you that the product line of Feminescence is built for the stage of life for the woman. There is, on the far left, there is the reproductive formula. Then for women going through perimenopause, the pink one in the middle, Maca Life. And then for women that are postmenopausal. And if you think about it, not every woman wants to go on hormones. Some women want to try to optimize their endocrine system naturally. They're looking for a supplement. The problem with a lot of supplements is that there isn't a lot of science on the actual supplement that is marketed. Some of them are very poor quality, and some of them may not be safe because of certain doses, or just not having the quality control measures. So I just wanted to feature this because I do think that the Feminescence products are very novel, because there are 4 published clinical trials in peri and postmenopausal women collectively. So the product has actually been studied in the population that it's intended for. And if we look at what it does, it helps to balance hormones. So you can see here, these are panels of hormones in perimenopausal women. So we have estradiol and progesterone. And when the women were taking Feminescence, their estradiol levels naturally went up, as did their progesterone, compared to the placebo group, or when they were switched over to the placebo. So there can be things that naturally boost and help to equilibrate hormones, like the Feminescence product, which is not any kind of hormone product. It's a plant product. So I will stop there. That's the website if you want more info.
Wonderful. Thank you. So the two of you have, in some ways, drastically different backgrounds. Yet I saw each of you nodding when the other person was talking, because you agree with each other, even though, again, you're in completely different situations. So we're going to move to this panel discussion, and it's super exciting to, kind of hear each of your take on these different things. To get started, we want to hear first from our audience, those that are here. We're going to kind of take this discussion from the beginning. So how do we recognize perimenopause? How does someone know that they're in perimenopause? And so first we want to ask the question to the audience of how confident do you feel that you can recognize or know that this is perimenopause? So your choices are very confident, I'm somewhat confident, not confident at all, or I'm not sure what counts as perimenopause. And, these, we'll say, choices. It's okay if you say, I'm not even sure what counts as perimenopause. That's completely fine to say that. So it looks like most people are somewhat confident. So we have, I'm going to take it as an educated group with us. So that'll be fun. It'll make our conversation even better. So let's go into, and again, you guys can take turns answering this question, but help us to kind of teach the audience here. What are things that you would tell someone, like here's some signs of perimenopause, or how would you help them to get to the skill level where they can say, I'm very confident that what these signs or symptoms of perimenopause are?
Yeah. I'll start. I'm going to take a controversial approach because I get this every day in my clinic. The question, am I in perimenopause? Yes or no? And my answer is often, does it matter? Because, just like what Dr. Minnick said, there is so much interplaying, between the endocrine system, your adrenals, your ovary, what's happening in your brain, your metabolic system. And there's changes. Whether or not it's actually perimenopause, in some ways doesn't matter because it doesn't give you a whole lot more information. Perimenopause can last for just a couple months for some women, and it can last for years for some women. It can be very severe for some and very mild for others. So the label in some ways is not helpful. What is helpful is understanding what those symptoms are that you're experiencing and addressing them. And I would say in a holistic way. I'm a big fan of the 4 pillars: nutrition, exercise, sleep optimization, and stress optimization. Just putting on an estradiol patch and a progesterone pill is not gonna, be the magic wand that fixes everything. It's a whole lot more complicated than that. And so, teasing out what are hormonal changes and what are, just some of the changes as we go through midlife transitions is really difficult. Some of the most common things that women present to me with, I watch my husband going through those same things. So in some ways, women have the double-edged sword with the hormonal aspects in addition to just, the course of your body changing through midlife. But in many ways, the perimenopause label isn't always important because we can treat endocrine disturbances, metabolic disturbances, hormonal disturbances that are affecting your life, whether it's perimenopause or not.
That's a good point. So it's not like a different disease, like we'll say diabetes, that once you get a diagnosis, then your course of action is completely different. This is really more of a continuum. And so caring for yourself, this is, part of how you care for yourself in general, not just I think people think, well, if I just get through this, current situation, perimenopause maybe, then they think it'll all be better. But I think both of you agree that this is much more about learning how to care for ourselves better every day.
Yeah, definitely. I really like what you said, Dr. Mendigo, about being a little bit disruptive about the terminology, because we tend to think of women's health in these classic phases. And sometimes it's a continuum where it is a spectrum and we do need to look at symptoms. I just had a couple of things to add to the mix. One is that I think that sometimes women aren't in perimenopause, so to speak. It's actually menstrual dysfunction, or there's a need to balance hormones. And I think that there's some confusion, and maybe you can speak to this a little bit more, relative to truly menstrual health and fertility, and making sure that, I think women are getting confused. They're thinking, oh, am I going through menopause? When it's really that there is some imbalance there. And so just giving more hormones, I don't know if that's just going to solve the issue per se. And I just feel that taking a root cause approach, looking under the hood and really getting into, okay, what am I eating? How am I sleeping? What is my stress level? Is that coinciding with my menstrual irregularity? So is it really something else and not perimenopause per se? So I don't know if you see that as well in your patients.
I could not agree more. And that's why I say to a large extent, the label doesn't matter. I think, menopause has a very clear clinical definition. unless of course you have a hysterectomy, then it gets a little blurry, or an endometrial ablation or a Mirena IUD. But it's 1 year of no vaginal bleeding whatsoever. Very clear. Perimenopause is not quite as cut and dry, and there's a lot of overlap in symptoms. We quantify this time period that is very vague before perimenopause as your late reproductive years. So oftentimes women are wondering, am I in perimenopause? And I say, no, it's your late reproductive years. You're not having significant irregularity to your periods yet, but you are noticing changes. And that speaks to the continuum that yes, you get into your 30s and your 40s, you do notice some hormonal changes. That is natural. And after pregnancy or during breastfeeding, you may notice that your body feels a little different than it did before. And it's not necessarily perimenopause, but you may notice more inflammatory changes, more metabolic changes. I see a lot of those, and they may be perimenopause, or they may not be. They may be for entirely different reasons. A lot of emotional changes, which are hard to tease out. Those can be early perimenopause symptoms or just midlife symptoms. Midlife is hard. That's why we have midlife crisis. But certainly, your hormones, whether endocrine or metabolic, male and female hormones all play a part in that. And then, we characterize those really nuanced menstrual changes that women notice that are too subtle that nobody else would notice. Perhaps when you were in your early 30s, you had that like precise 28-day cycle. And now you've noticed sometimes your cycle's 26 days and sometimes it's 29 days. We wouldn't call that irregular, but to any given woman, that's a change. Maybe she doesn't have super heavy periods, but they're heavier than they were before, or they're lighter than they were before. There's a change. So it doesn't necessarily have to be perimenopause, but if it is affecting your ability to function at work, at home, if you're noticing that you feel you're disrupted, then there are many modalities that can fix that.
Yeah. And when you talk about, the functionality, right? Like how, as we move our way through the decades and we become a little bit older, we may need to course correct. And one of the things is with sleep, because as we get maybe into our mid to late 40s, we may start to note that, wow, I'm not sleeping as soundly or as deeply, or why am I waking up between 2 and 4 a.m.? And that's regular. I even had a friend who would have a 2 a.m. wake up text thread that she would have with her girlfriends. It's like, no, that's not a good thing. We don't want blue light at night. But it was so bad. And, she just didn't know how to cope with this. But I think that sleep, based on the women that I talk with, this is the most disruptive element. And it may require some lifestyle changes in a big way. Like maybe she can't do alcohol at night like she used to. Maybe she can't be eating so close into bedtime like she used to. She can't get away with those things as much, right? Her melatonin is coming down with age. So her circadian rhythm isn't being set as tightly. And so her blood sugar may also be off, which could be waking her up in the middle of the night as well. So I do think that the sleep conversation is a big one to start to have. We know that it's been tossed around before about sleep is the new medicine and how important that is, because how we sleep many times will determine how we eat the next day. And then we might crave more simple carbohydrates and more energy because we're so fatigued. And then it's a vicious cycle because now we don't feel like exercising because we have no energy. And so now like our whole day falls flat, and then we just flop into bed again and then do the whole thing all over. So somehow getting control of, I like to call it circadian rhythm hygiene, like really looking at mapping out your day, your daytime hours, your nighttime hours, making sure that you're eating during the daytime hours, or at least during the time that it's light outside, because hormonally you'll be better primed for metabolizing those foods at that time. So I think that, I'm giving a whole presentation coming up on circadian rhythm and aging and hormones. And I just feel like, even though I've studied nutrition all my life, it's almost like circadian rhythm comes above nutrition and exercise, because you can eat healthy foods at the wrong time and have an untoward effect. You can have an unhealthy effect. So again, everybody on the call, really be thinking about your 24-hour rhythm, what you're doing when you first wake up. That is so important for setting the stage for the rest of the day, and even more important as you start to feel more symptoms. And so just even looking at that, mapping it out with a coach, with a practitioner, and tightening that up a little bit or changing certain things.
Amazing. I think
Rose, what do you think about all
I think it's one of those things. So my background is as a fertility awareness educator. And so the women I help, they track their cycles very carefully, cycle after cycle after cycle. So they're pretty quick to recognize that something is different. So their bleeding pattern has shifted. So maybe they used to bleed 4 or 5 days. Now it's 4 with a day they don't bleed, and then all of a sudden they're bleeding again. Or they're bleeding more or less. So their bleeding pattern they recognize is different. The day that they ovulate can be shifting, and the actual hormone patterns themselves can be changing as well. And so I think those women who track their hormones really can identify some of these shifts a lot sooner. And again, it may be perimenopause, it may be because of their current lifestyle, but they know that something has changed, so they can take a proactive approach to support themselves better. So real practical things of, something is changing. I better change something if I want my hormones to stay regulated, as long as they can be. So I'm always advocating for balanced hormones that allow you to have a normal menstrual bleed, ovulate, and a normal luteal phase as long as we can. Because that's, it's ovulating is kind of optional in the sense that our bodies won't do it if it is not in a good situation to ovulate. And so as someone gets older, I like to say it's a little bit more of a fragile system. And so one thing can set it off. And so then your hormones get disrupted a lot sooner or easier. And it can be harder to get them back in that routine and rhythm like they were. So again, a disruption, maybe when you're 20, that cycle just bounces back. And then when you're 40 or 45, something disrupts it and it doesn't rebound quite so quickly. So I have a real example of that. I had actually a practitioner who, at the age of 46, she donated her kidney to her sister. And she had had regular cycles up until her surgery. And then after surgery, her period didn't come back. She didn't get one. And then she gets her one snapshot in time blood test, and it shows that her hormones are very low. FSH is now very high. And she actually found me, because as a clinician herself, she was like, I can't keep going back to the lab every week and getting my blood drawn to see if my hormones have changed. I really need to be able to see them in a much easier way. And so she found Mirror herself, started using it, and now uses it in her practice. So I think all of this boils down to the more information women have, the better they are to be empowered and make better decisions for themselves, and also then seek out a provider who's going to help them. So with that, I'm gonna.
I was just going to say, to add on, the real time feedback is a very powerful motivator. And so, if we're talking about the importance of sleep and nutrition and exercise and stress reduction, kind of being able to see the impacts, in real time when you try to make lifestyle changes is incredibly motivating. And I think that's a huge value add that's missing from our traditional blood panel.
Yeah, I agree. And
Absolutely. Mm-hmm.
so if we think about like common things that I hear, or tends to be, I don't want to say, don't want to draw it to social media too much, but often, users, women really want to know, well, what do I do when I'm told my hormones are normal per the snapshot in time blood test, but like I know something is wrong. So I'll pitch that to you guys. What would you advocate for these women to do?
So typically, Yeah, if somebody's in my office, we don't treat those numbers. If your doctor is saying your hormone levels are normal, there's nothing wrong with you, it's all in your head, then you need a new doctor.
Mm.
And unfortunately, we've seen that a
Yeah.
lot. Women have been dismissed, and fortunately, I think that's changing. And that's why I think Menopause Society having that database of practitioners. I think functional medicine and integrative medicine practitioners are really adding a lot of value to the conversation there, because so many doctors have just said that's the end of the conversation, and out the door you go. And so that should be a red flag. If that is the only answer that you get, you need a new doctor.
Mm.
I agree. And it's almost like in this day and age, we almost need like a health team, somebody that is also, sometimes we get like three opinions on a house repair. We want to get like our roof repaired. So we get three different bids, but yet we go to like one practitioner and just take their word. And I think, that's a good starting place, but I do think getting a second opinion, a third opinion, building your health team, maybe again, that is, bringing in the integrative modalities like an acupuncturist or massage therapist. Just start checking out what's happening with you with a number of different providers to get different aspects of root causes, and what each one of them will see what you're going through in maybe a different way and offer you a different perspective. So I know that, just even for me personally, I know that that helps. And we can't forget, the emotional aspects too. I do think that bringing in psychological aspects, there are a lot of mood changes that can happen through this change of life as we move into menopause. A lot of anxiety, a lot of depression. So having support for that, and that might look like a support group. It might be a health coach. This is where I do think that having other types of practitioners there to support you in the process. There are even coaches that are more specialized in this particular area of women's health to kind of know what questions to help you with. They're not prescribing anything, but they're listening and holding space and helping to guide you in that process. So I do think that there are many other options these days.
On that note, I think I wanted to ask if the traditional space tends to be an OBGYN, but I know, Dr. Mendigo, you already mentioned that maybe just going to your general OB that you've already seen may not be your best option if they have not taken that extra step to be trained in perimenopause. So maybe you want to touch on that.
Yeah, and I do think we almost kind of need a new specialty of women's midlife care, because first and foremost, I'm an OBGYN. So I didn't get trained in advanced cardiology and neurology and immunology, GI, all of these things that are all interrelated. So I can look at it particularly through the OBGYN lens and may miss things that a cardiologist or a neurologist would see. And so having that integrative team approach, I think, is so important. I wish that there were integrated women's midlife centers where, all of those specialties were could talk to each other, much like a tumor board. You've got a multidisciplinary team looking after you and sitting in a room going over your case together. And I wish that women's midlife care was more like that. And I think that's where integrative medicine and functional medicine shine, because they do that so much better than traditional medicine. The big limitation when you've got insurance paying for your visit and a doctor who works for a healthcare system is time. Your first appointment is probably limited to 30 minutes, no more. And that is just scratching the surface. We can talk about prescriptions. We can talk about, what that prescription for bioidentical estradiol and progesterone looks like, and what the side effects and how to use it and what the risks and the benefits are. And that's it. You're out of time. You're lucky if you can achieve all of that in 30 minutes. So there's no time for the discussion about optimal nutrition and exercise and sleep and stress reduction and mental health and all of those aspects. And those are critical. So I think we need a team approach for sure.
Well, I think we just invented the new care that women need. Now we just need it to take off. So what kind of piece of advice, we touched on this a little bit, but if you had one advice for someone when they're, maybe they've already went to their doctor once, they felt dismissed, and now they're either going to go to the same provider again or try a different provider. Each of you have like advice or something that our audience could look out for?
Well, my advice would be definitely go to a different provider. If you felt dismissed the first time, try a different one. Dr. Minnick, I love what you said. Get a second opinion. I think as we were thinking about this conversation, Rose, you posed a question: when to ask for a second opinion? Always, 100% of the time. It's your life, right? Like there's an art and a science to it, and don't just take my word for it. So always get a second opinion. Three red flags for me that I would say, like, definitely look for somebody else. If you are come looking for, I want to start hormones, for example, if that's your ask, and you just get an answer, no, and that's the end of the conversation, 100%, that's a red flag. Get a different provider. Go to menopause.org, find a telehealth company that takes your insurance. Number one red flag. There are contraindications, but you should be having a conversation about what your contraindications are, because nothing in medicine is 0% or 100%. So even if you've got some contraindications, there's always room to talk about what the potential risks and benefits are so that you can understand. My number two red flag is if you go to a practitioner and they do offer you hormones and they're expensive, that's a red flag. If you've never been offered an FDA approved bioidentical estradiol, transdermal estradiol, or an oral progesterone, and you just skip right to expensive pellets or compounded options, that's a red flag. So consider another option. And number three is, certainly we talked about in the early 30s or late 30s, early 40s, it may not be perimenopause. There may be other factors at play, but if you're pretty close to the menopause transition, if you're skipping periods regularly and you're talking about menopause hormone therapy and you get offered Premarin or a synthetic progestin, and there's no talk about bioidentical estradiol, transdermal estradiol, and oral progesterone, if that didn't enter the discussion, then that's a red flag. Get another opinion.
I want to pause you there just for a second, because those listening may not know the difference of what you just said, and it was critical what you just said. So we're talking about, so sometimes people get offered what they think is hormone replacements, and it may actually be a birth control, or you mentioned Provera. So can you talk about that for just a quick second?
Yeah. So really the research is moving towards a term that we've used for a while, bioidenticals, and that is a specific kind of estradiol. So birth control pills have synthetic estrogens, largely ethinyl estradiol. And for a while, women were often offered Premarin, which is a conjugated equine estrogen combination that has some estradiol, but also some estrogens that are unique to horses. And then there is estradiol that you can apply transdermally. You can have it orally. There's the injectable versions. And that is what we call bioidentical. Estradiol is one of the major estrogens that our body utilizes. And recent research has shown that is a lot safer with regard to cardiovascular functionality and thromboembolisms, blood clots. than synthetic estrogens and Premarin. And then we go to the progesterone. So the same is true. So synthetic progestins have very complicated interplays with glucocorticoid receptors, metabolism. They're sometimes the culprit when women have weight changes or bloating with a synthetic birth control pill, for example. That may be the progestin component because they interact with so many different receptors in our body besides just the progesterone receptor. So a bioidentical oral progesterone that's micronized can have very different effects and is much safer for women navigating menopause and perimenopause than some of those synthetic versions.
So there's a comment in the chat here. So someone wrote, I was told by a women's health practitioner that bioidenticals are a sham. And he said they're just a expensive they were just expensive synthetics that were compounded and more expensive. You want to comment on that?
Yeah, so it depends. So that practitioner may have had the lens of back in the early 2000s, 2010s, that was the case. So bioidentical really was kind of a marketing term and not a medical term. And so there was a study that came out that was in the 90s that came out in the early 2000s that really created a lot of misinformation around hormones and was really the reason why a generation of women didn't have access to FDA approved safe hormone replacement therapy. And so to those practitioners, bioidentical kind of came up as a means to circumvent the FDA approved Premarin and synthetic progestins that had just come out as, these are dangerous. They cause breast cancer, they cause blood clots, they cause strokes, they cause heart attacks, all of these things that came out in the media that really weren't very specific to the very specific formulations of hormones that were tested in those studies. And B, we're in populations of women that we really don't give hormone replacement therapy to anymore, that were higher risk patients that were not likely to have benefits. So when we reanalyze that data, a lot of those conclusions didn't really hold true anymore. But that really shattered women's health, and a lot of women lost access overnight to Premarin and synthetic progestins that were giving them menopause relief. And so out sprung this bioidentical, which was largely pellets and compounded creams that subverted the FDA process and gave women another outlet when their doctors were just like, no, that's it. You're not, they're too dangerous. You can't have those. So now that we have kind of re-looked at that data and said, bioidenticals are not just these fancy compounded creams and pellets. You can actually get FDA approved bioidentical hormones. It's a little bit different. I hope that answers your question. It's a bit complicated.
Hopefully that shows how complicated it is and how if you are told kind of an immediate no, then again, that is a red flag that practitioner is probably not up to date and might want to consider seeing someone else.
And I think too that some women think that you can only get a bioidentical estrogen or progesterone if it's compounded. So again, just to reinforce what you said, I mean, you can get an FDA approved estradiol patch. You can get the bioidentical form of progesterone in an oral format. So that's widely available. Yeah.
And it didn't always used to be that way. Yeah.
Yes. Rose, one of the things that you had asked before when you were giving your red flags, Dr. Mandigo, about, look for this, I was thinking in my mind about just people I know who have been trying to navigate this space for themselves. And sometimes you may need like two practitioners working hand in hand. You've got your MD who's giving you the hormones, and then you've got maybe another MD who focuses more on lifestyle medicine, or and they do certain other things. And because, you know, just even in the case of, for me, a family member who, you know, she was feeling like she was seeing a functional medicine doctor, an MD, and there were all these tests, and she just really wanted hormones. And the functional medicine doctor had to do all of these different tests before she felt comfortable with giving her hormones. And finally, I advocated that she go to a certain virtual platform to explore getting her hormones, which she did. But then that doesn't mean that she can't do all the other stuff. And the doctor that she's seeing for the hormones doesn't do all the other stuff. So she's going to have to complement the hormones with somebody who can really, like, again, let's get deep into what's going on with you, what's going on with your gut, what's going on with your immune system. Let's check in with your sleep. And like, they can really spend more time with you. So I'm just thinking, like, best of all worlds is get what you need and work with somebody who understands you a little bit more in terms of your lifestyle.
Yeah.
I think they go hand in hand quite nicely.
Completely
also-
agree.
You kind of touched on something that, now, I don't know if you guys want my opinion, but a red flag for me is when the provider just also gives out the same thing to everyone without, you know, looking at your certain situation. And of course, with the ability to do this hormone tracking, we really can see maybe your main problem is low progesterone. You are still ovulating, but you have low progesterone. Maybe you're someone that has both low estrogen and low progesterone. And so your treatment is going to be very different based on your current situation. And like I mentioned earlier, when you're in your perimenopausal transition, you're a much more fragile system that's still, you know, hanging on. And sometimes you may get started on hormones and you feel worse. And it may be because it wasn't the best for you. So I've often heard practitioners that I work with, they say, in perimenopause, I have a whole tool belt of things I can do for my patients. But if I have things like mirror hormone testing, I can take away, you know, like instead of having 40 options, now it's maybe 20. And so we're not having to go through so many trials and errors and see which one kind of fits best for you. We can much more hone it into to you. So I don't know if either of you have a comment on that.
I agree completely. That was my tip number 5 is, you know, don't just think that it has to be transdermal estradiol and micronized oral progesterone, that there's a whole lot more to it. And you're exactly right. Everybody is an individual, and I'll say it again, it's an art and a science. And even over your individual journey, what works for you at time point A may need to evolve with you at time point B and time point C.
Yeah, absolutely. Personalization.
Yes. So let's talk about what do we see as hopeful signs or changing tides, or I mean, I don't know if we want to go into what just happened on the news. Was it yesterday or 2 days ago? But go ahead and share, some of your hopeful signs that you're seeing for women's health.
Yeah, I mean, I think things are actively evolving and changing, and that's always a good sign. You know, medicine moves slowly and is stagnant a lot. And I see a lot of disruption, and I see a lot of response to women demanding something better. You know, even in the past year, physicians have woken up and realized that so many of us aren't trained and are trying to do better. So I just did my continuing medical education to renew my annual board certification for OBGYN, and there was a huge menopause component that was much richer than it ever was before. I attended the American Academy of Family Physicians annual conference, huge menopause curriculum. And then the Menopause Society meeting was like sold out instantaneously. So, you know, we're listening, and physicians are recognizing their deficiencies and they're correcting them. Telehealth is providing access that there wasn't before. Functional medicine is providing an integrative approach that there wasn't before. So I think we're moving in a positive direction.
And I think at the level of research and science, there's been a clamoring for more women-focused research. We can't just apply all the studies on men to women. And I must say, even in graduate school, I was told by my female advisor that we were going to do a study in men because women were too complicated, right? So you can just imagine that that was the predominant thought around women, like, oh no, they're just too complicated because of their hormones. So let's not test them. Let's just keep it simple and test men. So we need to play some catch up there. And so that is happening. We see that happening in nutrition. We see it happening in exercise science and physiology. As you know, people like Stacy Sims will talk about women are not small men. So they have, you know, probably nuanced approaches to exercise, and maybe even per their life stage, we might need different kinds of exercise. And then, you know, I just think we need more there. Rose, what I think you were speaking to was the removal of the black box
Yeah.
per the FDA, right? So the warnings on hormones, and how that's another symbolic unveiling of transparency and empowerment for women, and also, you know, practitioners and patients to have that conversation in less of an obstructed way. So it's boding well, I think. But then I think I think when we were just first talking, when you open up the floodgates of all things menopause, you're going to get a lot of stuff coming through where it's like, now, how do I know what's true and what's not true? How do I know what works and what doesn't, right? So we need to also continue to be more discerning and have that perspective and checks and
Yes.
balances in place.
I think what's exciting for me is I'm seeing that research is being done on women now. And um, I'm glad that Mira gets to be in somewhat a small piece of it. And what I mean by that is there are about 20 different researchers who have contacted Mira in the last year to use us as the way to track women's hormones. So then they have a control, or they can account for how the hormones are changing that research. And so previously, again, many research wasn't done on women, or it was done on women who were on birth control, so they didn't have fluctuating hormones, or it was done on their early follicular phase, so they had low hormones. But now we're seeing studies like the one done out of University of Toronto that was published last summer, really looking at how women's glucose levels change throughout the cycle, and that the researchers really said, historically, the research wasn't as good because they couldn't account for what phase of the cycle the woman was in. They had to rely on the woman saying when their last period was. And so now that they have tools like a continuous glucometer and Mira, they really were able to find a significant association between changes of glucose levels throughout the cycle. So I'm excited to see the research. It ranges from ADHD, perimenopause, how sleep apnea changes throughout a cycle, treatment for things like PCOS, endometriosis. So to me, the hopeful sign that I'm seeing is Mira is being used as a tool in many research studies. So I hope to see big changes in the future.
Yeah, that's great. And again, with Feminescence having 4 published clinical trials, that's really unheard of in the supplement industry. Usually what we find with supplements is you piece together, there's a term for this, like we call it mixology, where you have like one study on turmeric, and so you take it, or one on ginger, and you kind of put them all together and you say, okay, well, I'm assuming that they're all going to work in that same format that they worked in the studies, but you don't actually know unless you've actually tested that formula in that population. So that's why you have to be wary of supplements, because I call it the shiny object syndrome. You know, there's always something new at the market, and something that looks very appealing, especially to women, because the branding is done right. But you've got to ask the questions. It's three parts. Is there science on that particular supplement in the population that it's intended for? Is it safe? Does it have a history of safe use? And is there a quality aspect to it? How is it manufactured? What do we know about whoever is making the supplement? And it's not that supplements are unregulated. It's just that sometimes they make more robust claims than they actually have science to support, but they are regulated. So just keep that in mind. You have to just ask a number of questions there.
And I will say it's interesting to see actually women who are mirror testing and they start something and you actually watch their data change. And so it's a feedback to them that what they're taking is working for them. Now, it's not a blanket that'll work for everyone, but to speak to your product, I've seen Maca Harmony in someone with, they have one cycle without it, and then they have their next cycle, and their estrogen is dramatically different. And so it's very interesting to see, just like any change that you make, is this change good for me? Like when I change my lifestyle, whether that be your diet, exercise, food you're eating, what is that doing to your hormones? And sometimes, again, your body can, we'll say, kind of deal with things for a while until it can't anymore. I've seen that with women who are, they're change what they eat, they change their exercise, they change all these things. And it's like, well, I was doing fine. And then all of a sudden they stop ovulating altogether. It's like, well, when you look back, how many things can you pile on before your body's like, that's enough. I can't keep ovulating or can't keep my hormone production going. So, okay, well, we are over on time. So I don't, excuse me, I don't see any last minute questions in the chat, but I want to make sure to put out the poll question here. So as a final poll question, we just want to know, after today's conversation, what is one thing that you feel inspired to do? So is that go talk to your provider, or maybe get a second opinion from a provider? Track your symptoms more intentionally, learn more about hormones, seek out different sorts of support in a community, or make some of those lifestyle supplement changes. So I'd love to hear what everyone plans on doing. And then to close out, if the two guest speakers, if you have kind of like a closing remark or a last piece of advice you have for us as we part.
I mean, I
really
think,
like this. Oh, go ahead.
Go ahead.
Go for it.
I was
Oh,
just
no,
gonna
this
say,
has been inspiring to me.
all right. Oh, so I was just
Go
gonna
ahead.
say, I think my closing thought is, this is a holistic approach, and if anybody tries to tackle it from just one dimension and that's it, then I think they're missing the point. So there's a multitude of different tools in the toolbox, to use that same analogy. And those tools may change throughout your life. And you're ultimately the one that knows your body. And we're here to help you make the best choices to live your best life.
Well said. And just to add to that, I would say for women to be empowered about their bodies, learn about your body. And I love how, one of the things that we asked you about was, what are the questions and how do you actually inform and work with a provider in more of a discussion dialogue way? So the more that you know, the more that you'll know the questions to ask. So it's great that you took the time to be part of a webinar like this. So, and not only the empowerment, but then also, I think that there's something really liberating and transformative about going through these changes. I think that there's a lot of fear, a lot of apprehension, kind of this feeling of chaos. And I would say the more that you embrace this in a way of moving into this next phase of your life, I feel that that perspective will lead to less symptoms, or at least less feeling like they're burdensome, but that you're headed into a direction that will give you more in the way of learning about yourself. I do think that there's something there. And we look at all of these wise women that have gone from menopause into postmenopause, and really looking at the elders and looking at women who have gone through this. And many of them are really in the prime of their lives. They're writing memoirs. They're neuronally in their brain. They're actually some of the best contributors to society. That was even a publication in a medical journal. So the sky's the limit. That's what I would leave you with.
Wonderful. Well, thank you again for the two of you being here. I think We learned, excuse me, a lot from each other, and it's just a great to hear the attention being brought on women in the right way. Again, a positive. We're advocating for ourselves, but also seeing ourselves as um, becoming more of who we are. We are women who have hormones that fluctuate, and then eventually they don't, and that's who we are. And embracing that is going to have good outcomes. So thank you both for being here. Thank you for our audience, and hope to see you at the next event.
Thanks so much.